our next speaker, who's going to be talking about systematic review and evidence synthesis. And I should say, I hasten to add that I misread the poll results. So you're right, there are fewer people familiar with evidence gap mapping, more people saying that they're familiar with systematic review, but I'm sure there's always more to learn from that, and certainly quite a wealth of findings and learning from the efforts of Oxfam and Feinstein to improve the use of systematic review in humanitarian action. So we're really grateful and excited to be joined today by Ellie Ott and Roxanne Cristalli. Ellie is the Humanitarian Evidence Programme and Communications Manager in Oxfam's Global Humanitarian Team. And before joining Oxfam, Ellie worked for UNHCR, as well as for a refugee empowerment NGO in Zambia, and for the US federal government, where she oversaw rigorous anti-poverty research and policy, including the management of systematic reviews and randomized control trials. Roxanne is the Humanitarian Evidence Program Manager at the Feinstein International Center at Tufts University. And prior to this position, Roxanne has worked as a researcher, humanitarian practitioner, and advocate at the intersection of gender and armed conflict. Through their joint humanitarian evidence program, Oxfam and the Feinstein International Center have commissioned a set of 8 evidence syntheses and systematic reviews in the humanitarian sector, which have been carried out over the past year. We're now going to hear from Roxanne, who's going to be giving us a presentation on this really interesting work, and then we're going to hear from both Ellie and Roxanne in the Q&A session. So I'm going to hand over now to you, Roxanne, to hear about this program and what you've been finding.
Thank you very much, Alice, and good morning to everyone from Bogota. In the time that I have, I will be discussing the Humanitarian Evidence Program, which, as the name might suggest, synthesizes existing evidence-based research and seeks to communicate the findings to decision makers, including humanitarian practitioners, policymakers, and fellow researchers. I'm going to touch on 4 questions. First, why would we do this? Why would we synthesize existing research rather than conducting new prospective field research? Secondly, how are we going about this? What really does it mean to systematically review the evidence in a particular area? And specifically, what does it mean to do this in the humanitarian field, given the realities of the data that we have in our sector? Third, how did we decide on the areas in which to synthesize evidence in the humanitarian field? And I will close on the 4th note of insights and challenges that we have encountered along the way. In this slide, you can see the 8 areas in which we decided to synthesize evidence-based research as part of the Humanitarian Evidence Program. So we have these 8 areas for evidence synthesis, and before delving into how we decided on these particular ones, I want to talk a little bit about why one would do this, why we would synthesize existing research. And I will focus on 2 reasons, with the rest being detailed in our program guidance note. The first is that looking at a body of evidence can be more powerful than simply cherry-picking individual studies. So rather than saying, I have read this particular study on cash, and here's what it says, we're looking at the body of evidence on cash and what that body might tell us. The second is that our impulse may be to go and collect new data and interview new populations, and that is an exciting process and an exciting prospect for knowledge. But by looking at the body of existing evidence first, we are minimizing the burden of affected populations by conflict and disasters, the burden of narrating their experience again and again through multiple surveys and multiple inquiries by researchers and practitioners. So that to us is a compelling reason to do evidence synthesis. How did we settle on these particular topic areas, on the 8 topic areas that you see here? We took a 3-pronged approach here. First, we looked at what evidence is already synthesized, since it would be against the spirit of the program to commission an evidence synthesis on an already synthesized area. And this is where the work of 3IE and IRC has been really particularly useful for us. We have mapped existing evidence synthesis in the humanitarian field, and you can find that on the Feinstein website in case it is of use to others on this webinar. Second, we went straight to the community, and hopefully including many of you on this webinar, and we asked, if we were to synthesize existing evidence in particular areas, of our field, what would you want to know? What are you curious about? I'll talk a little bit about the pitfalls of this question on my last slide. And so from them, we have heard certain things through a survey and key informant interviews that essentially illuminated particular areas for evidence synthesis. And then the third thing that we did is we cross-checked that area of interest with availability of evidence to find that sweet spot between interest of our stakeholders in seeing the evidence synthesis, but also making sure that the evidence is actually there for us to synthesize. So if you look at the survey results, the number one response of what people were interested in seeing evidence on were transitions from relief to development. We did not, in fact, commission an evidence synthesis on this because we could find too few studies that actually tackle this particular topic. So this is a case of something that would be an opportunity for prospective research, but not really particularly suitable to evidence synthesis. So through this three-pronged approach, we really looked for that sweet spot between interest and availability of evidence to arrive at our list of 8 topics. I'm now going to move on to method. What does it mean to do evidence synthesis in the humanitarian field? And this is where we borrowed from the systematic review approach. The systematic review approach emerged in the medical field as well as in the field of public health and has been widely used to essentially bring together bodies of evidence and see what results arise when that evidence is compared beyond just looking at the individual studies themselves. What we have found is that that approach is very useful, but needs to be tailored to the realities of data in our field. I'm going to touch on just 2 types of tailoring. The rest you can see in our guidance note on evidence synthesis in the Humanitarian Evidence Programme. The first is that much of the systematic review approach essentially assumed laboratory settings. It assumed perfect control over your environment. It assumed the possibility of randomization that is not always feasible or ethical in the humanitarian field. At the same time, we don't think that this means that humanitarians don't generate evidence or that we cannot systematically bring it together. It just requires a more tailored approach, and that is what the program has set out to do. And so our method is listed in this guidance note, as well as on our briefing papers on evidence appraisal, which essentially touch on how do you tell one type of evidence from another? How can you tell how much confidence we have in particular findings? And how do you go about the process of assessing the evidence that you have synthesized? All of this information is listed in our published protocols. What a protocol does is essentially it says, this is the approach that I am using to synthesize evidence. It is a means of transparency, if you will, in the review. How did we decide which studies to include in our urban humanitarian action review and based on which criteria? What information did we extract from each study for our analysis? Where did we find our studies? Did we search the gray literature as well, the various institutional reports that many organizations in this webinar produce, or did we just search the academic literature? And so the protocols are currently available on both the Feinstein and the Oxfam sites, and you can browse them. Next, I am going to discuss some of the various insights that we have come up with along the way, focusing on 4 specific areas of lessons. The first is this question of evidence synthesis versus evidence generation. One thing that we have found is when we asked people, what do you really want to know from the existing evidence? The answers they gave us were actually questions for prospective research. So it's, what do you want to know right now about the Syria crisis? What do you want to know right now about humanitarian partnerships? As opposed to questions that can be answered by looking at existing evidence. To us, this is very exciting because it does suggest directions for future research, but it also suggests that we may not necessarily know how to answer questions about evidence use and evidence synthesis. It may be that our impulse is to just continue to do new and exciting work as opposed to using the work that exists. And that, to us, is an imperative to raise awareness of evidence synthesis and its use within this field. The second and related challenge was on the volume and the quality of evidence that we found. When we were starting out, we were warned about volume, and specifically that we would not find enough evidence to synthesize. For some of our reviews, that has indeed been true, but the opposite has also been true. That sometimes we have found thousands of hits, particularly in our questions on mental health or in WASH. So how do you bring together this vast body of evidence to have meaningful conclusions has been a question that we're really struggling with. And similarly with quality, how can you assess different types of studies and different methods? Next, and relatedly, tailoring the systematic review approach, we find that we're speaking to a couple of different audiences. We're speaking to the systematic reviewers who have a very particular methodology for whom the tailoring may actually be a compromise on the quality. And we're also speaking to the humanitarians who want to know, what do the various studies say, regardless of this particular process that we are using? And so trying to strike that compromise between addressing these audiences in a systematic way has been interesting. And I'm going to close on the note of building in research uptake from the beginning, and also on the politics and subjectivity of evidence. For us, we've tried to be as consultative throughout this process as possible. We've tried to synthesize evidence on questions of importance to the sector. We've tried to involve our various stakeholders from the beginning, because we believe that if people are involved in setting the question, they're much more likely to use the output that emerges from this evidence synthesis process. At the same time, it's important to understand that evidence is political. The determination of what counts as evidence is political and subjective. And so we want to be very mindful of what is it that is excluded from this focus on evidence-based research? Which types of voices, which types of methods, which types of studies might we be disqualifying by labeling them not evidence? And so that is something that we'd love to hear from you more about in the Q&A. Thank you very much, and over to you, Alice.
Thank you, Roxanne. Thank you so much for a really interesting and honest look, actually, at systematic review and its relevance for humanitarian decision makers. Really, really good stuff. Look forward to getting more into that in the discussion.